All right, NCLEX Bootcamp just launched 4 readiness tests that predict your likelihood of passing the NCLEX. And here's a sneak peek from readiness test number 4, where we need to figure out which of these problems could cause a low pressure ventilator alarm. So remember, the mechanical ventilator kind of knows how much resistance it's going to meet just to inflate the client's lungs. And if it meets less resistance than expected, you get a low pressure alarm. And if it meets more resistance than expected, you get a high pressure alarm. So what kind of alarm would we have if the client accidentally self-extubated or just pulled that tube out? Well, in that case, the breath is going to be delivered freely into the room instead of meeting the resistance of the client's lungs. So that should cause a low pressure alarm, but let's check out our other options just to be sure. What if the client bites the endotracheal tube? Well, if they bite it, that's going to narrow the path for the air to travel through and cause a high pressure alarm. Then if they develop a pneumothorax, well, remember, in a pneumothorax, the lung kind of ruptures in one spot and air builds up and pressure builds up in one side of the lung cavity. So that would also cause a high pressure alarm. Then if the client has secretions in the ventilator tubing, just like biting the tube narrows the path for the air, secretions being present in the tube narrows that path, and you're going to get a high pressure alarm until you suction the client. So of all of these, the only one that could cause a low pressure alarm is if the client self-extubated. And we're correct. Great job.